All right, here we go. This is case study number 5, and this is found in module 6. And if you're watching this video, then you're already here. So this client was a 40-year-old female, 5'6", 150, athlete in college, etc. And as you read through this, nothing really sticks out too much. And there's some fluff in here that you have to get rid of. She's tried different motivational programming. Also, none of it is really stuck at this point. So if you really kind of dissect this paragraph and read through it, here's how it breaks out for your 8 and 1. She's 40 years old, so she's under 55, so that's not a risk factor. Mother died of a heart attack at 52, which is under the age of 65 for females. That's a positive risk factor. Smokes 2 packs a day. That's a risk factor. She's relatively inactive, though as somebody who's trained people, I can tell you she'll probably have a real competitive driver to her, having been a college athlete, and also will probably recognize some of the discomforts that are found in training and might even embrace those as something that she has missed for however many years she's been out of an athlete. But anyways, relatively inactive, so that's a risk factor. And then we get a little further down, BMI is good. Her blood pressure was high. She's over the 130 and 80, so that's a risk factor. And her total cholesterol, though you don't have LDL or HDL to help you out here, the total cholesterol is 335, so that is over 200, so that's a positive risk factor. So you'd have 5 positive risk factors here without any negative risk factors. Okay, so if we scroll this down a little further, we broke this out so you can take a look and read through these notes here. What I found is with the questions, and I'm going to pause this here and jump over to the questions. So for question 3, list of signs or symptoms for CAD, pulmonary or metabolic disease, and which of these does the client have? So what I'm trying to do here is I'm asking you guys to list the things that are indicative of CAD, pulmonary or metabolic disease. Shortness of breath and activity, is a real simple example. And then which ones does your client have in this case study? And if you read through the case in the initial part of it, she didn't complain of, pain or discomfort in the chest, any kind of lightheadedness or weakness or nausea. No pain or discomfort in the arms or shoulder. There was, what else? No swelling in the feet or hands, no heart palpitations or anything like that. So, this client, though you can list all of those things and list those for CAD, pulmonary and metabolic disease, she doesn't have any of them. So in this one, I was kind of generous in terms of giving points if you listed everything. And then if you stated that she had none, then you got full points on that one. Would the blood pressure for this client be classified? Stage 1 hypertension. The client needs a medical exam or doctor, and this tends to throw people off. And according to the ACSM, I'm going to take us back out to the algo. But does this client need a medical exam? Years ago, it was one of those where almost everybody was advised to go see their doctor before working out, and that really became this overwhelming sea of people to go see the doctor. And eventually it became this ACSM algo allows us to kind of differentiate from people who first exercise or don't exercise, and then people who within exercise or not exercising show signs or symptoms. So I think people get kind of confused on this, and I have to admit the verbiage on this is a little bit murky, but we've done this enough where in this situation does not need clearance for moderate, but does need clearance for vigorous. And we'll go ahead and go through the algo here in a second. Okay, we're back. So this, as I'm scrolling through the document, just want to point this out. You have the 136/89 for this client, which will put her in stage 1 hypertension. Scroll down a little bit further. We did not have blood glucose on this. Now, I will state this, with blood glucose not available, if you listen to or watch one of the presentations I'll put out there from the ACSM, their guidance on this is if there is not a test result provided, then you should consider that as a positive or negative, or I'm sorry, as a positive. So meaning if the blood glucose levels are not provided and you don't know if it's over 100 or not, you should still consider it a positive. I didn't grade you down on this one because you'd have to really do some searching on the internet to find that one, and it's not been presented that way in the class. So with this client, she does not work out, and then she does not have any cardiovascular, metabolic, or renal disease. And to that end, we don't have any known metabolic or renal disease, so it takes that off the table, nor does she have any signs or symptoms, so that comes off the table as well. Though she is a smoker, though she is sedentary, though she is has family history as well, and that could lead to eventual signs and symptoms, she did not present with chest pain, weakness, lightheadedness, shortness of breath, any of the things I mentioned earlier. So to that end, she does not have any of these, and there are no signs or symptoms suggestive of these as well. So that puts us in this side of the algo in this column. So to that end, medical clearance is not necessary. And when you get further down here, you can jump into light or moderate intensity exercise. And this is where it gets a little bit murky, I have to admit, but we've done this enough where you can progress to vigorous exercise following the guidelines. Okay, that compressor's off in the background. I will say this, with the final and doing our final case studies, I will definitely amend some of the verbiage just to make this a little less confusing, because this seemed to be something that's a little bit of a challenge for the students who are trying to work their way through this algo. But beyond that, most of you are really catching on and doing quite a good job in terms of being able to wrap yourself around the concepts that were presented with the algo. So I'm happy about that. And again, if it comes down to it, you just do something as simple as this. You put your 8 and 1 format up and you break it down into 8 and 1, and you just basically cut and paste those right in. And then from there, you come up with a positive, 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 or not positive, not positive, not positive, and then you can do the math from there. All right, guys, I got to move on to another case study.